Hello, my name is Ashwath Narayan. I live in Ranka Colony and I have come to Bangalore recently in 2020 late in December, January 21. During that time, previous to that I was in Pune and I used to have get my dental work done from the doctors in Pune there. And thereafter when I came in 21 January, so I started finding out who is available nearby. And I came to know that opposite to Ranka Colony there is one Devika Shetty. So I thought whether she will be able to do my requirement. So after meeting the doctor, I felt how my half problem is sorted out, because the doctor's confidence we get from a doctor while talking to them itself is half curing. That is the case in all doctors. When you talk to a doctor, you get confidence in them, and during the treatment, the confidence that we have in the doctor, it makes the treatment successful. So after seeing my bone structure, then the teeth, everything, then she suggested that the 2 teeth are there which are to be implanting is to be done. So she had no idea that I can afford or not, because every customer need not be having so much money to spend on such type of things. And so she said it will cost some money, but whatever is the minimum that could be done, it will be done. But 2 teeth cost approximately, she told me, right? And then he said because your age is around, at that time my age was 78. See, first is that whether your bone structure, the bone density of the upper jaw and the lower jaw can take the drilling operation or not. You have to go through the CTBC, the cone bore, CBTC. Some cone bore test is to be done. So that was the only thing that they used outside service. So they asked me to go to some nearby place where the core bone test was done. Then after studying the core bone density test, they found that I'm going out of my this thing, that even though my teeth is very crooked, it is not nicely like arranged like a flower, so it is in all sorts of shape. But my teeth was quite strong, difficult to remove also. So after that they told me that it can take care of it. How do we go about it? Then they told me the cost of it. Then I agreed for the same thing. Then it was first told to me that we have to prepare a foundation for the 2 teeth implant, and that after making that foundation, it will take about 2-3 sittings. And there is a special doctor who is experienced in this type of implant, the major work. So they are Dr. Mahantesh or somebody, and he used to come for such type of work as and when this Dr. Devika Shetty was requiring. So that person also came, and after he also studied my core bone test, whatever is conducted. Then the date was fixed for drilling operation. And one thing I wanted to tell, but both the Mahantesh as well as the main doctor here were all of unassuming type of nature. I mean, they don't behave like a big doctors where they would like to see only some important patients and like that. They are unassuming, and particularly Mahantesh, he was so knowledgeable in doing the artistic work. But I consider the dentist work is like an art work. It is not that you may have knowledge about the dentistry or implant this thing. It is an art to do something. It is nothing like, that artwork is only possible people who have got the artwork, irrespective of their appearance, whether they are short or tall, is immaterial. But they found that the Mr. Mahantesh was very good in his work, and he was always, when he is doing that operation, drilling or anything, we had some signal system that whenever you feel the pain, because doctor cannot feel my pain. So my pain, there is to be a signaling system by either I press something or I show my thumb or something like that, so that he doesn't go beyond that to see that the pain is not there. So after the root this thing was fixed, the foundations were done. So they told me that it will take about 3 months for the bone, whether my jaw has accepted these foreign elements. These foreign elements are the screws and that studs or whatever they are fixed up. Sometimes it doesn't accept for certain people. So first is we don't do anything further unless 3 months we watch the adverse thing happens due to these insertions which we have placed. So we were kept for watching purposes, but I was given certain instructions as to what should we eat and how it should be taken, consumed, so that without affecting that area. And so such instructions were easy to follow. It was not very difficult. After 3 months, the date was fixed for this thing. Then a person from the was taking for measurement. They had to take the measurement of the 2 implants. So they decided that what should be the measurement. Measurement was taken, and that was another 1 or 2 sittings were there. Then when the item that complete teeth was ready for fixing, proper dates were given to me. And first is a pre-test. That means whether what has been delivered by the person, because this is an artistic work, the manufacturer of that implant dental portion is some person who is doing that work. So whether it has been done according to the instruction of Mahantesh was important. And then we were called for putting that into position, whether it is sitting properly or not. Then after ensuring that everything is perfectly sitting, then only it was given for final finishing, and further date was fixed up. And somewhere after, I think about 4 or 5 months later, that means after 3 months, I was away out of station, so it took about 4 months. Then the 5th month, it was fixed up, and I should say that during the process of everything, right from the core bone test up to the finishing stage, I did not feel any pain whatsoever. That depends upon individuals, I don't know, but and also the artistic way of the handling of the doctor. It both depends on the individuals. Some people scream if there is a pain. So such type of things did not happen to me. And because of this successful thing, I have referred this to many other patients. I mean, if somebody wanted something, I have mentioned this I got it done and I am fine for this. Then my daughter-in-law, my son, they are youngsters. This type of implant is always for people, unless an accident case for a youngster, only it requires implant and other things. Otherwise, it is mostly for people who are elderly people, beyond 60 to 80. And those people are the people who wants all sorts of questions to be put. And the 2 doctors, Devika Shetty and Mahantesh, both were so humble in nature. They have a lot of patience to answer some stupid questions also. Some of the, whatever questions which may be something very stupid for them, but people who are aged will ask such type of question without getting angry. They were giving proper reply, and that boosts up the morale of the person. And I again thank that this dental shop, whatever you are having. So it is not a very, when I have seen so many other places, it is not like a showpiece, a big hall and with a lot of instruments and things, and without delivering what you want. It is better to have good doctors with got skill to do good work. Let it be one room and a small operation theater or something like that. That gives a better results. This is my feelings. I forgot to tell that the operation of implant was done in 21st, completed, started in September 21 and completed in 22nd March, completely, financially settled, then all work done properly, and past 2 years I have no problem whatsoever because of the good artistic work done by them, and the doctors. I can only say that it is because of the doctors, two doctors who attended. My work was done very nicely, and I have no problem in the implant done. Regarding the operation which done on me for that implant, I wanted to mention that after the operation was over, right, and all amounts were paid to the doctor as their fees, I just came to know from other doctors who have been doing similar work or something like that. Their prices were much, I cannot give a percentage how much, much higher, very much higher than what Devika Shetty has charged me for the extraordinary work done by them. And I do not know for the higher price which other doctors were likely to charge me, what would be the outcome is unknown to me. Here at least the known devil, that is the work done is known to me and the charges is known to me. The other one is charges is more and the work is unknown. So I just wanted to mention this, which it slipped out of my tongue, and I forgot to tell that. And in that way, that only shows that they were not money-minded type of doctors. They are doing to recover their cost. They have to live. No, if somebody has to run a clinic, he has to run the clinic, run the family, they educate their children at a higher level. All this requires money. So from that point of view, their charges are very, very reasonable when compared to so many other, big hospitals which charges are exorbitant. Thank you.